Coming to radiation therapy, before radiation therapy was given on older machines called cobalt machines. But now we use linear accelerators, that is Linacs, what we call. It is basically X-rays, but high energy X-rays. So it targets the cancer cell and it kills the DNA of the cancer cell. Cancer cells die because of that.
What if a cancer cell is below some other cells?
So that is why whenever we give radiation, some amount of normal cells also gets affected. But in normal cells, it has a potential to regrow. If given adequate nutrition and other things, it will regrow. So that is why the change in techniques. So as advanced techniques are there, the dose going to the surrounding normal structures is less and less. So we have a technique called stereotactic technique, that is we are doing routinely. So in that, if the cancer size is very small, less than 2 to 3 centimeters, we give only to the cancer cells. Surrounding cells do not get even significant dose because of the very, very high precision.
So if I have a cancer in my GI, you just expose me to radiation, or do you have to cut open some parts?
No. You don't have to cut open. There are 4 steps basically in radiotherapy. First is called molding. That is, we make the patient lie down on the machine, and we have to make sure that during treatment, patient does not move because it is very precise. So if you move, you may miss the tumor.
Even an inch? No?
Yeah, we are not supposed. The patient is
You
supposed.
tie the patient.
No, not tie. We have a sort of a mask that is made of thermoplastic.
It is customized for the patient.
Customized for the patient. Only during the treatment we place it. It will be comfortably tight so that the patient doesn't move. Second step, with that mask and everything on, we take a CT scan of the patient. Step 3 is on the CT scan, we mark each and every slice where the tumor is there. So there will be around 1,000 slices, sometimes 500 slices, sometimes 100 slices, sometimes 1,000 slices, depending on what area, how big the tumor is. So each and every slice is marked on a CT scan.
Slice is X and Y axis of
all
the
the axis,
organ.
everything.
Okay,
so that when we draw that particular tumor, at the end, entire tumor will be covered. So along with that, we give some margins. Now we know that tumor is there. Surrounding also, we give some margins. That is the third step. Fourth step is radiotherapy planning. So now we know that there is a tumor in the ear, but we also know that our normal organ, liver, comes there. Behind our colon comes. There may be lungs there. So we have to avoid that region. That our team, they are called medical physicists, they plan it. That this particular dose radiation should go only to this point, should not go to any other structures. So that takes 1 or 2 days. So that is the fourth point. Fifth is delivery. So once everything is done, we treat the patient on the machine. So on that day, that radiation, wherever that is there, it is delivered.